Meantime, an alarming number of new cases of diabetes being diagnosed, but the patients, not who you think.
News 5's James Gherardi looked into the shocking new stats recently published by the CDC.
Type 1 and Type 2 on the rise, get this, among kids. The findings have doctors raising concerns and making sure parents know the signs and symptoms of diabetes among their children.
She just wasn't acting right, but it was nothing that I had experienced with the other children.
Isola Barzacchini was just 1 year old when she was rushed to the ER with the telltale symptoms of diabetes.
She was just lethargic at times, craving water, and by the third day of this, her breathing became real intense.
The 7-year-old is the youngest of 5. None of her older siblings have ever displayed symptoms of diabetes, and genetically, there's no trace of the disease in either mom or dad's family history. The CDC reporting Isola is not alone. In a 10-year study of kids from just a few months to 19 years old, it was discovered each year there was an increase of nearly 2% of new type 1 diabetes cases and an increase of nearly 5% of new type 2 cases.
Frankly, we don't know the cause.
Isola's doctor, pediatric endocrinologist with the Cleveland Clinic, Dr. Roy Kim, finds the surge in new diabetes cases alarming.
We know that individuals must have a certain genetic predisposition to be at risk for type 1 diabetes, but there must be other environmental triggers, and frankly, we just haven't figured out what those triggers are.
An increase in type 2 among kids can be linked to an increase in childhood obesity. Type 2 is directly tied to weight gain, lack of exercise, and unhealthy eating habits. But what's confusing is a rise in type 1, a lifelong condition with the root cause still unknown.
What goes underappreciated is how life-changing the diagnosis is for those kids and what they have to go through.
It doesn't ever go away. You don't ever get a break from it. It is literally 24/7 that you have to manage it.
For Isola's family, managing her disease is a full-time job. Her blood is checked for insulin first thing in the morning when she wakes up, at every meal, and after physical activity, which must be limited. It's the same story for millions of Americans. Every 23 seconds in this country, there's a new diabetes diagnosis. It's estimated those patients will pay around $14,000 a year in medical expenses dealing with the disease. All these factors are elevated for children, learning to live a new life not run by their illness.
Ultimately, in her lifetime, I'm hoping they have a cure.
Symptoms parents should be on the lookout for: increased thirst and urination among their children, a feeling of constant exhaustion or hunger, sometimes weight loss, and in its severe form, type 1 can lead to vomiting, severe dehydration, and a coma-like state. For News 5, I'm James Gherardi.